My name is Anna Sandoval, and I am going to present Community Health Workers and Research Studies, Lessons Learned in a Community-Based Oral Health Study. I would like to acknowledge the co-authors, especially Myra and Monse, who are community health workers on the study. Co-op Chicago started 5 years ago with the plans to evaluate the impact of CHWs on oral health behaviors for low-income urban children under 3 years old. As background, dental caries is the most common chronic disease in childhood, and unfortunately, 80% of those affected by caries or cavities are lower socioeconomic status of certain minority groups or Medicaid insured groups. Our solution to this problem are community health workers. CHWs define themselves as frontline public health workers who serve as liaisons between health and social services and community residents to facilitate access to services and improve the quality and cultural competence of service delivery. This is according to APHA. This presentation will describe the role of CHWs in the implementation of a rigid intervention. We recruited 420 parent-child diets from Cook County from 20 partnership sites. There were 10 clinics and 10 WIC centers. The parents had to be English or Spanish speaking. The child had to be less than 36 months and have the two front teeth halfway erupted. We randomized each of the sites, and in the end we had 5 WIC sites and five health clinics in the intervention arm. From these sites, there were 211 dyads that received a community health worker. The community health worker also provided education and resources at the partnership sites. So the intervention included training CHWs. We trained over 20 community health workers and we hired 3. The intervention included 4 community health worker home visits and 4 follow-up phone calls. Ongoing training included the CHW shadowing a dentist and pediatrician, meetings with the PI and manager, meetings with the health psychologist to bring forward issues that they were experiencing in the field with the families. And then they also participated or provided education and resources once a week for half a day at our partnership sites. And this was for all the families or patients at these clinics, not just the ones in the study. Here are some photos of the training and then one of our CHWs at work in one of the homes. Our CHWs had 420 face-to-face interactions throughout the life of the study. Each visit lasted a little bit over 60 minutes and each family received about 2 visits. The intervention was addressed at the family and household members present during the CHW visit were encouraged to participate. Here I picture a baby shark toothbrushing model and also a model made with construction paper and cotton balls to help engage the parent and child address oral health activities. Topics covered during the visit included oral health, weaning, nutrition, seeing a dentist. I want to talk a little bit about other because many of the times our CHWs found themselves in situations where they had to assist families with things such as Medicaid enrollment, legal assistance, finding a job, or any other psychosocial issue that needed to be addressed before they could actually begin speaking about oral health issues. At our partnership sites, there were 1,518 encounters with non-participants. And at the end of our study, we did an evaluation follow-up survey, and I just want to read a quote from a participant. It was good because it made me more concerned about brushing my child's teeth more often because I was not doing it as often before. Other results from the perspective of the CHW. They felt that the successes they had were that they were able to help families in great need, they were able to build relationships, and then they were the liaison between family and investigators. Challenges they encountered were the implementation of a study protocol that was rigid, being familiar with recap data entry, having to introduce themselves and reintroduce the role of a CHW with the participant, navigating chaotic schedules, and then also they often encountered lack of interest from the parents, specifically on oral health. CHW insight is invaluable. We recommend that CHWs are included at the table from inception to finish when planning a research study and/or program. We also recommend proper support for them to be successful. Next for Co-op Chicago is analyzing the data to find out if the intervention worked. Please look out for our manuscripts and/or community reports on our website. Thank you.